Dear friends, this video is going to help you get a brief understanding of immunoglobulin. What are immunoglobulin? Immunoglobulins, also known as antibodies, are glycoprotein molecules produced by plasma cells or white blood cells. They act as a critical part of the immune response by specifically recognizing and binding to particular antigens, such as bacteria or viruses, and aiding in their destruction. Immunoglobulin molecules are glycoproteins composed of one or more units, each containing 4 polypeptide chains. 2 identical heavy chains, H, and 2 identical light chains, L. The amino terminal ends of the polypeptide chains show considerable variation in amino acid composition and are referred to as the variable V regions to distinguish them from the relatively constant C regions. There are 5 primary classes of immunoglobulins: IgG, IgM, IgA, IgD, and IgE. These are distinguished by the type of heavy chain found in the molecule. IgG molecules have heavy chains known as gamma chains. IgMs have mu chains. IgAs have alpha chains. IgEs have epsilon chains. And IgDs have delta chains. Now we will understand each classes in details. First, we will look into IgG. What are the properties of IgG? The molecular weight is 150,000 Dalton and it is H-chain type with molecular weight gamma 53,000 Dalton. The normal serum concentration is 10 to 16 milligrams per milliliter. The percent of total immunoglobulin present in plasma is 75% and glycosylation by weight is 3%. IgG is distribution via intra- and extravascular route. The main function is secondary response. Properties of IgG. IgG is the major immunoglobulin in blood, lymph fluid, cerebrospinal fluid and peritoneal fluid, and a key player in the humoral immune response. Serum IgG in healthy humans presents approximately 15% of total protein beside albumins, enzymes, other globulins, and many more. Determination of IgG levels can provide additional insight into the manifestation of disease. Main IgG subclasses. First, IgG1. IgG1 comprises 60 to 65% of the total main subclass IgG, and is predominantly responsible for the thymus-mediated immune response against proteins and polypeptide antigens. IgG1 immune response can already be measured in newborns and reaches its typical concentration in infancy. A deficiency in IgG1 isotype is typically a sign of a hypogammaglobulinemia. Second subclasses is IgG2. IgG2, the second largest of IgG isotypes, comprises 20 to 25% of the main subclass and is the prevalent immune response against carbohydrate, polysaccharide antigens. A deficiency in IgG2 is the most common and is associated with recurring airway or respiratory infections in infants. Third is IgG3. IgG3 comprises around 5 to 10% of total IgG and plays a major role in the immune responses against protein or polypeptide antigens. Fourth subclasses of IgG is IgG4, comprising usually less than 4% of total IgG. IgG4 does not bind to polysaccharides. Testing for IgG4 has been associated with food allergies, and recent studies have shown that elevated serum levels of IgG4 are found in patients suffering from sclerosing pancreatitis, cholangitis and interstitial pneumonia caused by infiltrating IgG4 positive plasma cells. Properties of IgM. Molecular weight is 900,000 Dalton. H-chain type is mu and has molecular weight 65,000 Dalton. Serum concentration is 0.5 to 2 mg per milliliter. Percent of total immunoglobulin is around 10%. Glycosylation by weight is 12%. Distribution mostly intravascular and its function is for primary response. The role of IgM in the immune. IgM is the first antibody built during an immune response. It is responsible for agglutination and cytolytic reactions since, in theory, its pentameric structure gives it 10 free antigen binding sites, as well as it possesses a high avidity. Due to conformational constraints among the 10 Fab portions, IgM only has a valence of 5. It is of vital importance in complement activation and agglutination. IgM is predominantly found in the lymph fluid and blood and is a very effective neutralizing agent in the early stages of disease. Elevated levels can be a sign of recent infection or exposure to antigen. Properties of IgA. Molecular weight is 320,000 Dalton. Alpha H chain type molecular weight is 55,000 Dalton. Serum concentration is around 1 to 4 mg per milliliter. The percent of total immunoglobulin is 15%. Glycosylation by weight is 10% IgA distributed via intravascular and by secretions. Main function is to protect mucous membranes. The role of IgA in the immune response are as follows. Most IgA is present in secreted form, such as saliva, tears, colostrums, mucus, sweat, and gastric fluid. IgA is found as a dimer connected by a joining peptide. This is believed to be due to its properties in preventing invading pathogens by attaching and penetrating epithelial surfaces. IgA works together with lysozymes also present in many secreted fluids, which can hydrolyze carbohydrates in bacterial cell walls, thereby enabling the immune system to clear the infection. IgA is predominantly found on epithelial cell surfaces where it acts as a neutralizing antibody. IgA deficiency in disease leads to recurring infections of the airways or a kidney disorder. Severe health conditions that can lead to low levels of immunoglobulin A in the body, one of which is gonorrhea. Selective IgA deficiency are more prone to autoimmune disorders like rheumatoid arthritis, lupus, allergies and asthma. IgA deficiency in disease recurring infections of the airways or a kidney disorder. Severe health conditions that can lead to low levels of immunoglobulin A in the body, one of which is gonorrhea. Selective IgA deficiency are more prone to autoimmune disorders like rheumatoid arthritis, lupus, allergies and asthma. Properties of IgD. Molecular weight is 180,000 Dalton. Delta H chain type with molecular weight 70,000 Dalton. Serum concentration is 0 to 0.4 mg per milliliter. Percent of total immunoglobulin is 0.2%. Glycosylation by weight is 13%. Distribution by lymphocyte surface. Function is unknown. Properties of IgE. Molecular weight is 200,000 Daltons. Epsilon H chain type with molecular weight 73,000 Dalton. The serum concentration is 10 to 400 nanogram per milliliter. Percent of total immunoglobulin is 0.002%. Glycosylation by weight is 12%. Mostly distributed as basophils and mast cells in saliva and nasal secretions. The main function is to protect against parasites. Properties of IgE, found primarily on eosinophils, mast cells and basophils. When antigens such as pollen, venoms, fungus, spores, dust mites or pet dander bind with the Fab portion of the IgE attached to the cells degranulate and release factors like heparin, histamine, proteolytic enzymes, leukotrienes and cytokines. As a consequence, vasodilatation and increased small vessel permeability causes fluid to escape from capillaries into the tissues, leading to the characteristic symptoms of an allergic reaction. Most of these typical allergic reactions like mucus secretion, sneezing, coughing or tear production are considered beneficial to expel remaining allergens from the body. Studies have shown that conditions such as asthma, rhinitis, eczema, urticaria, dermatitis and some parasitic infections example helminths and tapeworms lead to increased IgE levels. Binding of eosinophils with Fc receptors to IgE-coated parasitic helminth worms results in death of the parasite. Low levels of IgE can occur in a rare inherited disease that affects muscle coordination, ataxia telangiectasia.